My name's Clint Ray. I'm an orthopedic surgeon with Core Orthopedics. Been here in Anniston for 20 years. My specialty is, I'm actually a sports medicine specialist. I'm also a hand and upper extremity specialist. My practice is basically a third hand surgery with some of the harder hand stuff, a third sports with shoulder scopes, knee scopes, ACLs, and about a third my total joints. Technically, outpatient surgery is surgery that's done and you go home within, 23 hours. It could mean that you spend the night, it could mean that you don't spend the night. I've been doing total joints outpatient now for the last 2 years, and they've all gone home the same day. Some of that's been COVID related, but it's also been a process that we've developed over the last couple of years where people have all they need at home, and we help set that up. So it's a seamless process. They go home and they do fantastic, to be honest. I mean, the ideal patient to go home as an outpatient from a total joint would be somebody relatively young, relatively thin, relatively healthy. I have sent 80-year-olds home the same day, but they were also driven, physiologically young, and not terribly overweight. It's really an advantage if you can be thin and be healthy, then you definitely can go home first day. If they get up and walk, and they can walk safely, and they can control their quadriceps mechanism, and they pass physical therapy, which is a very, very good organization we have here in the hospital, and they work hand in hand with us. If they pass what they say is a safety evaluation, then they go home. If they're not safe, whether it's from a medical standpoint or a physical therapy standpoint, they shouldn't go home, and we won't let them go home. We've been working hard with the hospital for the last couple of years to develop an outpatient program, and the patients benefit from it. It's amazing to see them when they don't feel sick. You don't treat them like they're sick, and you do their surgeries and they go home, and as long as you have everything set up at home to make it convenient and safe, then the patients do better. I would do mine as an outpatient, without a doubt.